Hello, how are you?
Good, how are you?
Good, good. My name is Roxanne. I'm a student nurse from Cedarville University. I'm going to be your nurse practitioner for today. How would you like to be addressed?
As Thomas.
Thomas, and your last name is Ngwar?
That's correct.
Okay, let me make sure we have the right information here. When were you born?
I was born February 2nd, 1958.
So you are 57 years old. What is your occupation?
I'm a manufacturing engineer.
Okay. How did you hear about us?
My doctor referred me to your clinic.
Good, good, good. So what brings you here today?
I've been having some persistent pain in on the side of my stomach.
Okay. How long have you had this pain?
For about a week now.
What makes the pain different from what you've been having from a week ago?
It's just not going away.
Okay. Can you describe the pain to me?
It's a sharp pain that pierces the side of my stomach like a spear. Very sharp.
Is there anything that makes the pain better?
When I sit down, when I sit down it gets better. When I stand up, it appears to be worse.
Okay. So, what times of the day is the pain worse?
The pain is worse during the day.
Okay. All right. Any relieving factors?
So far, no, nothing.
Can you rate your pain for me from 1 to 10, 10 being the worst? How bad is your pain?
Right now?
Mm-hmm.
Was about 8.
8.
8 or 9.
Wow. Okay. So how did you get here today?
My son drove me.
Okay. What is your religion?
Presbyterian.
And what is your culture?
I'm African.
Okay. How many members are there in your family?
6.
Okay. All right. Let's see. Now, can you tell me how your appetite is?
I have not been able to eat recently because it's too much pain in my stomach.
How is your sleep pattern?
When I lie down, I sleep, but every now and then I have to wake up.
Is there anything that helps you to cope with the pain, like help you sleep?
No, I haven't taken anything.
Okay. Now, do you have any other medical problems that are going on?
No.
Have you had any hospitalizations in the past?
No.
Any illnesses?
No.
Any surgeries in the past?
No.
Any serious injuries or disabilities?
No.
Any major childhood diseases?
No.
Okay. Any other pertinent information about any medical problems that you might be having?
No.
Okay. Have you had a TB test recently?
No.
Okay. How about any X-rays?
I haven't had an X-ray in 2 years.
Okay. Have you had any dental exam, any vision or hearing test recently?
About 4 months ago, I had my dental.
Okay.
And I just recently saw my eye doctor.
Are you up to date with your immunizations?
I believe I am.
Okay. Have you had a TB test done?
No.
Okay. Now, how much do you drink?
Water. I drink about 4 cups of water a day.
Okay. How much alcohol do you drink?
Every now and then I get a glass of wine, and I drink about a beer or 2 in a month.
Do you smoke?
No.
Okay. Do you take any caffeine?
No. I was
Okay.
advised against caffeine.
Okay, good. How is your sleep pattern? How much sleep do you get in a day?
Not a whole lot of sleep lately.
Do you have any medications that you take? Over-the-counter medications, prescription medications?
I have a lisinopril that I take for my blood pressure.
How much is that? How much do you take? Do you know the strength?
I don't know the strength, but I take 1 tablet a day.
Okay. Do you have any allergies? Any
Not
seasonal or
that I
food
know of.
allergies?
No.
Okay. Do you take any drugs other than prescription?
No.
Now, with your family, do you have any family history going on? Any heart disease, any blood pressure, cancer, tuberculosis, stroke, sickle cell disease, cystic fibrosis, epilepsy, diabetes, gout, kidney disease, thyroid disease, asthma, allergic conditions, forms of arthritis, blood diseases, sexually transmitted infections, any hearing or visual problems in your family that you know of?
No.
Okay. Any genetic disorders?
No.
Okay. Any stress issues going on with your family or in your family that you know of?
No, not right now.
Okay. What does your typical day look like? What do you do on a
Get up in the
typical
morning,
day?
go to work, come back, and start my taxi job, dropping my kids to and from sports.
All right, let's move on here. How has your blood pressure been?
With the medicine I'm
Medicine?
taking, it's been good.
Okay, okay. Do you feel like you're always weak, or do you get easily fatigued?
No.
Okay. Now, can you tell me how much you eat in a day?
I have 3 meals a day, breakfast, lunch, and supper.
Good. How is your appetite?
I think my appetite has been good, except recently with this stomach problem. It's been a little poor.
Any skin, hair, and nail issues that you have?
No.
Any rash or skin problems that you have anywhere that you know of?
No.
Okay. Any new or recurrent conditions?
No.
Okay. Any problem? Have you ever felt any lymph nodes in your thyroid area?
No.
Have you ever felt? Okay. Any previous lumps or nodules in your neck or groin area?
No.
Okay. Any enlargement anywhere or tenderness?
No.
Okay. Around your head or neck, any problems going on?
No, no problem.
Okay. Any problems with your eyes or vision? Any problems seeing?
No, I wear contacts. So
Okay.
that's,
Any discharges from your eyes? Any redness? Okay. Have you ever had any glaucoma?
no.
Okay. Any problems with your ears, nose, and throat?
No.
Any problems with dizziness, vertigo, or any surgeries that you've had in the past?
No.
Okay. Any problems with the nose, any nasal drainage,
No
any
problems.
polyps or hearing loss?
No, no problems at all.
Okay. Any problems with your teeth?
No.
Okay. With your gums? Any problems with your chest and lungs?
No.
Any problems breathing?
No problem.
Any cough or shortness of breath or any infections recently?
No.
Any pain related to your breathing?
No.
When was your last chest x-ray?
2 years ago. I can't remember the exact date.
Okay. Any problems with your heart? Any chest pain? Any dizziness? Any shortness of breath? Any swelling in your legs?
No.
Swelling in your palms?
No.
Okay. When was your last EKG?
I'd say about 2 years ago.
Okay. Any tenderness around your breast area or any lumps that you felt in your breast?
No.
Okay. I think we talked about your appetite already. Any ulcers, any GI issues, any nausea or vomiting with this stomach that you've been having? Stomach
no
problems?
vomiting.
Okay. Any jaundice, any gallstones, any polyps or tumor?
No.
Okay. Other than this abdominal pain, any other pain that you're having?
No.
Okay. Any problems with your genitals?
No.
Okay. Any problems with infertility?
No.
Any endocrine issues?
Not that I know of.
Okay. Any diabetes that you know?
No, no diabetes.
Okay. Any problems with your thyroid? Any heat and cold problems? Any unexplained weight loss or weight gain? Any problems peeing a lot or drinking a lot of water?
No, no problem at all.
Okay. Any problems with your muscles? Any weaknesses in your muscles, arms and legs?
No.
Okay. Good. Any joint stiffness?
No.
Any pain or swelling or redness or heat?
No.
Any deformities that you know of? Do you use a cane or a walker?
No.
Okay. Any neurologic problems any problems with your central nervous system?
Not that I know of.
Any seizures, tremors, tingling sensations?
Yeah, I had some tingling in my right hand.
How long have you had that?
About a month.
Has anybody seen you for that? Any treatment?
Yes, I've seen a neurologist.
Okay. And is it helping, the treatment?
Yes.
Okay. Any loss of memory, weaknesses or paralysis?
No.
Any sensory or cognitive issues? Do you easily forget?
No, thank God.
Okay. Any mental or psychological abilities? Any stress?
No.
Any previous diseases or problems?
No.
Okay. Any problems with your endocrine system?
No.
All right. Thank you very much, Mr. Ngwa, and I'll be back to see you so that I can do a physical assessment. I'm going to give you this gown to dress, and I'll be back to do a physical assessment. Thank you.
Thank you.